Hello, everybody, and welcome to this week's 30 Minutes program. We're going to be talking about pets today with one of the nice guys in the business, Dr. Joe Adcock, and a man who's very caring for not only pets, but for people, because your pet is your family. Dr. Adcock, would you say that's true?
It's become very true. Pets nowadays are just part of the family. Treated like them, loved like them, and in most cases taken care of like them.
And, you know, in being in your work here in Martin at the Weakley County Veterinarian Clinic, you see a lot of people come and go. And I'm not going to put you in a spot here by asking you this, but I think you've seen people that care more about their pets than maybe they do other things.
You do see some of those. I have seen people that would go without food themselves to take care of their pets, for sure.
And why is it that people latch themselves on to a pet that they sometimes cannot take care of them?
Truly, I think it's just because animals are so forgiving and so giving. You know, that pet is happy to see you every time he sees you. You know, and you can't say that about other people or children or anything else.
Why do you think people love a pet? Why is it that they just find themselves attached to it?
So for the reason I just said, because they love them back so much, but also it gives them some well-being, you know, some feeling that they're doing good by taking care of this animal.
I know you've been in business here in Martin for many, many years. How did you get into the veterinarian clinic and decide you wanted to become a veterinarian?
Well, I grew up on a farm kid, taking care of animals.
Where was that?
In Middle Tennessee, a little town called Bell Buckle. I had a cousin that's 12 years older than me that went to vet school. He lived in Sparta, Tennessee. And I would go spend 3 or 4 weeks every summer with him, and he kind of steered me into being a veterinarian. You know, I wanted to do it because of being a farm kid, but then also because of my experiences with him, watching him help people and help animals. And that's just what I always wanted to do. I never wavered.
Now, did you grow up with a lot of animals at your house, for example, or maybe on a farm somewhere?
Oh, yeah, we always had cats. We had a dairy farm, so there were always cats around. But, you know, you can't really call those pets, you know. Yeah, we took care of them and we could pet them, but, you know, they weren't as important as pets are today. And, you know, I remember always having a dog, always having a pony, and then, of course, all the farm animals that we had also.
So you finished high school, went to college, and then you went to veterinarian school. Where was that?
I went to undergraduate school at MTSU and then went on to vet school at Knoxville. And, in fact, I was the first class from Knoxville. And because of my last name alphabetically, I was the first graduate from UT College of Veterinary Medicine.
Now that is kind of a check mark right there, or a bigger ring on your finger. I'm not real sure. So when you started, now that you've got your degree, where did it go? Where did it send you?
To start with, I took a job working for the USDA. They were having an immediate need at that time because of an outbreak of a disease called exotic Newcastle disease in chickens.
What was that?
And it's a viral disease that we did not have in this country and would have run rampant through the chicken population, killing enormous numbers of chickens if we hadn't controlled it. So I worked for them for about 4 months, and then I found a job here in Weakley County, and I've been here ever since.
So this is really the only place you have said, I wanted to be in Martin, and you've stayed here all these years?
That's it.
How many?
44 years.
What have you seen that you've never seen before? That one thing, we'll come back to it in a minute, and I'll give you a moment. But, you know, and being with someone who comes to be your patient, what do you call? Are dogs and cats called patients?
Yeah.
Much like
Sure.
we are? Okay.
Sure.
So when you see the patient, you know that you're probably going to outlive the dog or the cat or animal and so forth. So you have kind of an attachment to every pet.
Oh, absolutely. Absolutely. And I'm now working on my 4th generation of clients. Some of my first clients, I am now working on their great-grandchildren's animals.
It's amazing. And you ever talk about those, hey, when your daddy or your grandfather brought his...
Oh, yeah, especially the people that, when I did mostly farm practice, there was a big difference in that I might go to that same farm 3 or 4 times a week. So you knew the family, you knew the people, you knew their children. You know, if you were there at lunchtime, they weren't going to have you leave without sitting down and eating lunch with them. So you actually became part of those people's life. Now, with a small animal, not so much so, but a lot of those people that come in now, I worked for their fathers or grandfathers and remember them growing up. So,
you had a partner here for a number of years.
Yes. Dr. Huey Claybrook started the practice in 76, and I came here in 79. And for the first 20 years, we were almost all mobile farm practice, and then started easing into the small animal part. And, of course, now it's almost all small animal. I do still have a few large animal clients, but it's not many.
What is a farm animal that you refer to?
Farm animals would be mostly animals that are being produced for food or fiber, not as a pet, you know. So usually we really don't include horses, but we do sheep, goats, cattle, pigs, all of those we would call farm animals.
How can you tell that a farm animal is sick?
Usually they'll quit eating. That's the first thing most people will notice. Either that or in a herd situation, you'll have this one animal that kind of lags behind everybody else. When you put out the feed, this one comes up slower and slower than everybody else. And that's an indication that something's wrong.
In 100 head of cows, you can pretty well figure it out.
Sure.
And so what do you do for a cow that's, I don't know what disease they get. What do they get today?
Well, there's all a number of diseases, but of course you have to start with trying to find a diagnosis. And, that means listening to them, looking at them, maybe feeling certain parts of them, definitely getting a temperature. And you look for anything like a cough or a runny nose or, just several things that you have to take into consideration trying to get a diagnosis. And then there's also blood tests that you can run. They'll tell you maybe specific, because there may be 5 or 6 different diseases that cause basically the same symptoms. For instance, respiratory disease. But there are tests you can run to tell you specifically which one you're dealing with.
Can you tell by whatever means that you have, and I have great respect for you on this, but can you kind of tell if a cow, let's just say, is not going to be with us very long?
Both ways. I have been surprised by how sick something can be and then get well. But on the other hand, usually I got a pretty indication when I figure out what's wrong, if they're going to make it or not.
How do you take the temperature of a cow?
With a rectal thermometer.
How big is that thing?
About 6 inches.
A little bit of joking, but, there's a lot of things that go on inside, particularly when it's a cow. Now, those of you who don't know the difference between a cow and a bull, the difference is the cow can, we'll leave it at that. But the truth be known, there's a lot of danger dealing with farm animals.
There can be if you don't have the right facilities to handle them and keep yourself safe. And also, you just become animal smart with time. You can kind of tell, I can be around a horse and I can tell whether it's going to kick or not.
But you have to touch. You spend a lot of time touching a farm animal or a horse, maybe a camel. We'll talk about that in a minute. But, isn't that something that you have to have some trust with an animal that you are trying to take care of.
Sure, and even the dogs and cats. The tactile sense, feeling things, is one of the biggest diagnostic items we have.
How so?
Well, like, take for instance, cancer. I can palpate over a dog or a cat and pick up lumps or bruises or something that the owner probably hasn't noticed.
And with that, you pretty well can make a determination of where the hurt is.
Sure. And the other thing is your lymph nodes. You may have heard of lymph nodes. These are over your body and have to do with the immune system. When they become inflamed and enlarged, that tells you something is wrong. So depending on where that lymph node is and what area of the body it drains, gives you an indication of where the problem may be.
If you've just joined us, Dr. Joe Adcock is our guest. We're talking about veterinarian science, and I guess another thing we're just talking about is dogs and cats and other animals. First off, what is the animal that you really don't want to have to spend much time with? Would it be a squirrel? I have a squirrel, they say. It doesn't feel good today. Do you try to get in or get out of that?
Actually, the TWRA takes care of that for us, because it's actually illegal for you to own a wild animal and keep it in captivity without a permit, and they don't give those away very easily.
So deer is not considered a pet?
Nope.
And what else wouldn't be?
Well, anything, squirrel, raccoon, any wild animal.
So you don't...
Now, there are breeds of deer that are bred to be in captivity. Those are okay, but our normal whitetail deal, no.
My wife had, and I didn't have it. We had a baby raccoon that was left underneath a tree at our house. So she comes in and babies it, and the next thing you know, this little one, can get anywhere, can climb anywhere, can get out of the bathtub. And how they do this, I have no idea. But these things can grow all over the place and mess up your house pretty good too.
Oh, absolutely. But they can also become so accustomed to people that they're a pet. They respond to commands. They look for you to feed them and take care of them. And if they become dependent on people, they become more like a pet.
We didn't talk about birds. Do you have any birds that you see?
I see very few birds. Very few. I don't know if it's just not that many in Weakley County that are kept, or, of course, obviously things like canaries or parakeets, unless there's a big emotional attachment, economically it's not worth doing much to.
What about a parrot?
Well, there have been a few parrots around. Yeah.
And how do you treat a parrot?
Well,
you put a blanket over their head. That's a mask or something or other.
Mostly is having your staff trained to hold them correctly so that they don't hurt themselves. That's the biggest concern. Mm-hmm. But mostly it's trimming the nails, trimming their beak, just routine things like that. They don't really have anywhere to get exposure to disease. There's just one of them in the house and probably one of them in 3 city blocks.
Probably not any. I would say the number's in the 90 percentile that every young boy that lived out in the rural area probably has had his hands on, and girls too, on a turtle. Are turtles' life pretty long, and do they do anything besides snap at you from time to time? And do they make good pets?
Well, they can be a pet, and some of them actually live a pretty long time. I'm 30 to 40 years.
My goodness.
But the majority do not. The little painted turtles and the box turtles and the ones we're used to. Mm-hmm. But, they can still be a pet.
We were talking about certain animals that you don't need to have in your home because of TWRA, and I guess that would mean, I don't know, does that include doves? If you had somebody brought 2 doves that were still alive, brought them home and put them in a cage?
Them probably even more so, because they become under federal migratory animals. So when you get to the legal part of it, that's probably even more complicated.
I don't know why people would want to do, other than maybe to breed and then sell them and those kinds of things. You know, the thing that sometimes people have a tendency to do is to feed the animal, your cat or your dog, we'll say, from the dinner table. Good idea, bad idea?
Usually a bad idea. Their digestive systems are not programmed to digest the foods that we do, especially lactose. Most animals lose that enzyme on lactose. So that's cheese, milk, those things that a lot of times what we tend to give as a treat. The other thing is too much fat. You know, the worst thing you can do is have a cookout, trim all the fat off the steak and throw it to the dog, because this can cause a life-threatening disease we call pancreatitis by making their pancreas overwork.
So you're saying don't give the dog or the cat your steak? Is that what you're saying? The steak that you don't eat?
The lean steak, not so bad, but trimming the fat off of it can be bad.
Do you give them the fat? Say, don't do that?
Right, don't give them the fat. And,
don't give them...
And never chicken with the bones in it. There's nothing worse than a dog eating a chicken bone.
Well, let me take you to another step on that. So I'm told that it's not a good idea to take barbecue ribs and give it to a dog. Is that right?
Ribs, about the same thing. The reason is those hollow bones are so fragile, the dog chewing on them, they crack and break and end up with sharp points, and those can cause damage inside.
Well, it looked like it would be a very difficult time to excrete those, getting into the intestines and so forth.
And they can cause damage.
Oh, we don't want that. If you just joined us, Dr. Joe Adcock is on the radio with us. You know, there are things that we don't talk too much about, but one of them happens to be surgery. What surgeries, not that you do, but what surgeries are necessary that you see on a regular basis?
Well, of course, obviously the two most obvious surgeries we do are spays and neuters to control the abandoned population. You know, this is the most common by all means. And the other thing, which really not a surgery, but, you know, I think of it as surgery because sometimes it ends up, is cleaning teeth, taking care of the mouth. Probably 85% of our animals over 4 years old have some stages of dental disease.
And?
So, you know, that requires a professional cleaning and a lot of times some extractions if the tooth is abscessed or if it's decayed so bad.
A dog can't tell you when they got a bad toothache, can they?
Right, and they're amazing how well they hide things. You know, about the only way you can really tell is if you really, really pay attention. He may dribble some food when he's eating, or he may chew on mostly one side of his mouth and not the other.
Can you tell us what goes on in neutering and spaying and the process of how this comes together?
Of course, a neuter, everything is on the outside, so it is a fairly uninvasive surgery, basically a skin incision, tying off blood supply, removing the testicles. Spay, on the other hand, a lot of people think a spay is just some little simple surgery. It is not. It is a major abdominal surgery. You are opening this animal up and you're taking out vital parts. And if anything bleeds, it can lead to death if it bleeds too much. So it is a major surgery, even though a lot of people don't think of it as such.
I would suspect that you would tell the owner of the pet that these are serious procedures that you're doing.
Sure. And then, of course, any time when you're dealing with anesthesia, you know, today's medicine, it is super, super safe, but there is always a chance of something going wrong anytime you're using anesthesia.
Mm-hmm. And it's kind of the same anesthesia that the hospital has or the doctor's office or whatever it happens to be. So,
right.
Well, let me go into another subject regarding food. There are various places that you can get food from, probably your place, Walmart, online, and all of that. How do you know what to feed a dog or a cat?
Well, to me, there's basically three levels of food. You have what we call the premium foods. Now, it's okay to mention names.
Sure.
Those would be like Iams or Hills or Eukanuba. These are premium foods. They're made the same way every time they're made, same formula. Next level down, you have the store brand foods, and the commercial foods, which are like Purina, those type foods. And they're still good. I mean, they have everything in them, but they may make different changes in the formula depending on what's cheaper this week as far as what's going into them. And then you have the store brands, and they're a lot of filler in them, but they still meet the requirements that the animal needs. But there's a lot of filler, and what's important there is you'll see a lot more fecal material because it's not digestible.
Why is it a dog will not like certain foods?
Just like us, just like people, they just have different tastes. And I've seen animals eat the same thing for 10 years, and I've seen them eat the same thing for 6 months and then decide they want something else. So it's just a preference sort of thing.
Well, let's talk about e-collars, electronic collars for teaching, for calming, and or maybe keeping the dog and I guess cat too, I don't know, around the house, making them mind so if somebody comes knocking on the door, there's a way to at least slow the dog down or tell the dog don't do that. How do you feel about those?
It depends on how they're used, obviously. If barking is the problem, they actually make a collar that when the animal goes to bark, it will release citronella. Same thing, it's in the insect repellents that we have. And that takes their attention off of whatever. They smell that and they just immediately forget about barking. Or they also have some that give them a slight tingle if they go to barking. But then the training collars like hunters use, those are when the animal doesn't follow the commands. And you shock them a little to get their attention. But, as long as it's just a tiny tingle, it's probably not anything too bad, but it can be overdone.
So, in a recommendation, when would you start wearing a collar?
Well, with the barking, if you have the problem, if that's a problem, then think about doing something. Just because even if you tell them and get on to them when you're there, what do they do when you're not there? So, see, it kind of becomes a problem that the collar works better. But then the training, most of that is done somewhere between 6 and 2 years of age.
6 months and 2 years.
Right.
And big dogs have a tendency to be, not necessarily all the time, somewhat more aggressive than others.
Can be. And this is the other thing, kind of along those same lines, are these electronic fences. It's a line that you put under the ground around your yard. The dog wears a collar. When it gets within a certain distance of it, it makes a noise. If they keep getting closer, it gives them a little shock. And that's enough to deter most animals from going out of the yard. The problem with them is the neighbor's dog or stray dog or whoever not wearing a collar come into your yard and aggravate your dog, and then he can't follow them or chase them out.
All of that sounds logical to me. And to take that to the next level of training, I mean, training can be very expensive if you are training any dog, whether it be small or large.
Sure. And I always tell people, besides training to go to the bathroom, whether it be pad training or outdoors, the next thing is teach them to sit. If you can make your dog sit on command, no matter what they're doing wrong, you can stop them by making them sit. So you're way ahead if you get that done.
Let me ask you about chimpanzees. How many of these have you seen? Some people call them monkeys.
Well, I've only had one chimpanzee as a client. And that was quite an experience.
Tell me about it.
This chimpanzee actually wore children's clothes. It would sit in a high chair and eat its meals with the family. And it was just part of the family. It truly was.
that is taking on perhaps one of the most incredible responsibilities that you could ever possibly have. Because, and I'm not saying this because I know this, but I would suspect it's easier to raise a child than it is to take care of a chimpanzee, because that records almost 24/7.
And here again, you're making a big commitment, because they can live to be 35, 40 years old.
And where do you take a chimpanzee? To the doctor, to the veterinarian, or do you take it over to the hospital?
Well, that's a good question. I was lucky in that at the time I had this one, me and Dr. Bill were good friends, so I would usually give him a call.
But I mean, it's very difficult. It's a whole different
the primates
anatomy.
are much more like people than they are like an animal.
Yeah.
You know, much more similar, getting the same diseases. You know, that's one of the problems is they get diseases, one particular tuberculosis, that can be transmitted to people. So you have to be concerned about that.
Well, this is a little bit deeper into the conversation. Some of you people may be a little bit uncomfortable with what I ask, but did the chimpanzee go to the bathroom like we do, or did they have to go outside? How did they deal with that?
It actually would go on a pad, like a puppy pad.
Mm-hmm. Which makes it a little easier, and those kinds of things. If there is one animal, let me back up off that. Let me just simply ask you about the number of people that are feeding cats. So we have seen the cat woman, and we've seen the cat man, and they're out there and they're religiously feeding kittens and or cats. What's your take on that?
Well, you know, they're doing what they think is good. And if they're taking care of, like, a litter of kittens that their mother got killed or something happened, you know, sure, that's a blessing. But the people that are feeding the cats in the wild cat population are actually propagating the problem. You know, they're just causing these cats to congregate more in that area where they're feeding them.
So, good job, bad job, tough job, easy job. What's your take there?
On what? On
trying to, I mean, what if the cats have been told, I'm coming here at 6:00 on Friday night,
yeah,
but I'm going to be gone for 3 weeks, you know?
Right.
And I say that sincerely.
Right.
But,
and so we have a pretty large feral cat population in Martin, especially, and but there are people that feel a need to take care of them and feel like they're doing a service by taking care of them. And it says, as long as the cats aren't causing a problem, then that's a good thing. But now I know here lately there's been some problems where the feral cats were causing a problem. And there were so many of them there, they were going to the bathroom in flower beds or tearing up things, and that becomes a problem then.
Heat and cold. Cats and dogs both have fur, but maybe not all the fur they need, or maybe they need more fur. So my point is, or my question is, we're talking wintertime and we're talking the hottest summer we've had. Those tips are very helpful right now.
Animals do well in the heat as long as they have plenty of fresh water. You know, they can stand 100-degree weather, no problem. You know, the cold is a different story. Now, to survive in the cold, anything above freezing, or really above 40 degrees probably, they need somewhere that they can be dry and out of the wind. Because if they get wet and the wind blowing, they can definitely get hypothermic, just like we would. So that's more of a problem.
Hope you have been able to take away some of the good things that Dr. Joe Adcock has shared us. And I'm really glad we had a chance to talk about veterinary medicine and cats and dogs.
Thank you for having me, sir.
That's our program today here on 30 Minutes. Paul Tinkle, pre-recorded.
You've been listening to 30 Minutes, a community affairs program on Thunderbolt Radio. You can listen to this broadcast and others anytime by visiting thunderboltradio.com and following the Thunderbolt Radio and Digital YouTube page. Thanks for listening.